Although there are certainly many people who've been working with great passion on issues of healthcare access and equity for years, the more recent past has really amplified and accelerated solutions. Today, I'm thrilled to be talking to a woman who's made it both her business and her life's work to improve access to oral health. I became acquainted with Sonya Dunbar through a couple of my colleagues here at ACHC. As we prepared to launch an accreditation program for mobile dentistry earlier this year, Sonia's name just kept coming up. And not just because she was an industry resource with a wealth of knowledge to share, but also because she's a delightful person to know.
Beyond the Standard is produced by Accreditation Commission for Healthcare. ACHC supports quality improvement and patient safety by offering education and accreditation services that span the continuum of care. The views and opinions expressed on this podcast are those of the speakers and do not necessarily represent official policy or positions of the company or companies with which the participants are affiliated.
Sonia is a registered dental hygienist, holds a master's in healthcare administration, and is currently working on her doctorate. I'm so pleased to introduce Sonya Dunbar, aka the Geriatric Toothfairy, to the podcast. Welcome, Sonya.
Thank you for having me.
My pleasure. So I have to start with the obvious question first. How did you become the Geriatric Toothfairy?
Well, the story is the same. I started out as a younger hygienist when my grandmother was placed in a long-term care facility and they weren't properly taking care of her dentures. And I noticed that it wasn't just her. They weren't taking care of other people's dentures in the nursing home. So starting free, taking care of her dentures because she was my grandmother, and her roommate wanted me to take care of her. Then it was another person, then another person. Eventually, I was doing it all. And then when my grandmother expired, I felt the need to continue that because I think she would have enjoyed that.
Oh.
So I'm a dental hygienist. It just went with me because a lot of the people in the long-term care facilities are geriatric. They need the extra help. So that's what landed me being the geriatric toothfairy. It just grew on me.
That's great. And I mean, certainly catchy. So nobody's going to forget you. Not that they would forget you anyway, but with a logo like that and a name like that, nobody's going to forget you. So you're doing mobile dentistry within this niche of caring for seniors.
Mhm.
But I think there are other specific populations that are focuses for other mobile dentistry practices. Is that
Absolutely.
and can you talk a little bit about what some of those might be?
Absolutely. So yes, I specifically work. There's two types of mobile dentistry. I call it the pull and tow, where we pull and take all of our stuff to the location, or we can call it pop up. Or you can have when you have the van or the bus. But there are a lot of different types of mobile dentistry. I'm doing the nursing homes. There's mobile dentistry that goes into daycare centers, to Head Start programs, to schools. It's what I call the grown and sexy dentistry, where it's pop-up dentistry, kind of like Jet Dental, where they're actually going into whole corporations and taking on, or Floss Bar, they're going into whole corporations and setting up there and taking care of the whole staff, which I really like that because when I was in private practice, I noticed a lot of people did not come to the dentist because they didn't want to take off work. But now we're taking the dentistry to them.
Right.
And
So
there's also, I didn't mean to cut you off, but there's also another type that really grew over the pandemic, and that was home dentistry, where people with the vans that had one chair in the vans, they were actually going to people's driveway and doing root canals and crown preps. So ortho was big like that as well. So mobile dentistry is taking on its own legs, its own face, and it's been around for years, but I think the pandemic pushed it to the top. And I always say, there's some people who would never ever walk back through your dental office door, but they will allow you to walk through their door. So it's mobile dentistry is a different type of animal.
So it really is an issue of access because you're talking about everybody from young children through seniors who are benefiting from this service.
Absolutely. And it's, see, a lot of people think mobile dentistry is just for the underserved, but that
Mhm.
it's great for the underserved. It's great for people in rural areas. It's great for people that doesn't have access to care, like the seniors in nursing homes or some of the kids that go to Head Starts or lower income areas. But it's also all type of dentistry. One thing I want to say about mobile dentistry, it doesn't take away from the brick and mortar building. And that's what some dentists think. I know a lot of dentists who have a mobile arm linked with teledentistry outside of their brick and mortar. So you may have a hygienist that can go out of the office. You've freed up a chair where you can have a periodontist come in and work in that chair, or orthodontist or a surgeon. We freed up a chair in your brick and mortar where you have a hygienist in the field actually providing mobile care, still bringing in residual income in your staff, in your facility. So it's a lot of ways. There's a lot of ways we can look at mobile dentistry.
And so that sort of tees up my next question, because I was going to ask you, what is the relationship between mobile dentistry and teledentistry?
Oh, it's like Brent Herman says from Mouthwash, mobile and teledentistry goes together like peanut butter and jelly. They just go together. Now, I did have a son that liked only peanut butter sandwiches, but he's always been different. But mobile mobile dentistry and teledentistry, it just goes together. I'll give you a perfect example. Two of them really quick. For long-term care facilities,
Mhm.
when we go in, we're able to do a teledentistry exam with the dentist there. We can have the patient's family on the live. We can have the patient's physician on the live, so they can all see what's going on. Maybe the patient's having trouble swallowing. You can have the oral surgeon there, so everybody can have access to the notes, or they can be on live while we're doing the synchronous. Or if you go into the school and it's just a hygienist going out, you could do asynchronous, take pictures of the exam, send it to the dentist, and you can still provide that care, maybe providing fluoride or a prophy if the dentist cannot be there. So mobile dentistry and teledentistry, they go hand in hand to me.
And so, to that point, in addition to your own mobile dentistry practice, you are also a co founder of let me get this right, the National Mobile and Teledentistry Conference and the National Mobile and Teledentistry Alliance, along with your colleague, Melissa Turner. So,
Yes,
how did you go from running your own practice to running a national organization?
it's amazing. Well, Melissa and I both noticed the need to bring, it was the vision for the conference was just to bring all the mobile clinicians together from around the country.
Mhm.
And it just grew bigger than we thought it was. The first conference, we thought we were going to have one small room at the hotel. We ended up having the whole half of the Marriott airport in Orlando.
Oh,
And our
wow.
first conference had over 500 people from around the country that was doing mobile dentistry. And it was like a big family reunion. We were able to compare products and ideas and different ways of doing mobile dentistry, from pop-up mobile dentistry to school-based mobile dentistry. Is all type of mobile dentistries that was represented there. We were able to compare softwares and so many other things. So it started with the passion to bring mobile dentistry to other people. Melissa Turner and I, we just had that passion. And then from the conference, the alliance grew, because we knew that together we're stronger. And we needed to have a voice to influence some of the legislative laws that are taking place in mobile dentistry. We wanted to have a voice to move that needle a little bit.
So the conference came first, and how
Yes,
many years have you done that now?
this is going to be our third year now.
Great. And where is it this year?
It's in now. We just had it this year in Orlando. So 2022, March 3rd through 5th, 2022 is going to be in Vegas. And
Oh,
it's
wow.
going to be amazing, because what we're doing, dental professionals know that mobile dentistry, we know that dentistry and medical go together, the oral systemic link. So this conference is combined in mobile dentistry and mobile medical.
Oh, interesting.
Yes, we're going to have mobile physicians and mobile nurses, and we're combining those two together under one roof, and it's going to be amazing. We have a rooftop mobile van exhibit, and it's going to be big. We're
So
doing it
it
in Vegas, so it's going to be big. We're bringing a lot of educational CEs under the roof, a lot of vendors there, and one of the big things that I'm enjoying that we're going to bring is the opportunity for ACHC.
Well, and we're excited to be there with you. And I hadn't realized that it was expanding, and so we're really talking about telehealth
Yes,
as a
yes,
big picture,
absolutely.
which is awesome. So, um, well, since you brought up ACHC, let me ask you this. I know that you're in the process of preparing for accreditation of your own practice. And
Oh, yes.
why is accreditation important to you? Why do you think it's something people should be pursuing?
I know that it's important, and I know that it's needed in mobile dentistry. When we all came together, everybody was kind of off doing their own little thing in their own little niche. Mobile, the accreditation will bring a standard.
Hmm.
Does that make sense?
Absolutely.
It will be it will bring a standard of care.
Hmm.
And I'm going to share something with you, and it really hurts my heart. I've been doing mobile dentistry for 15 years. We've had our own. My husband and I, Gerald Dunbar, we've had our own business for 7, but I've been in it for 15 years. Been a hygienist for 30 years. I was in a nursing home. I was doing a walkthrough to talk to the administrator about being their provider, and it was a dentist there. He said, "Well, the dentist is here." The dentist was in a little room, had pulled the teeth, and had a bucket that someone was spitting in. So we don't. That's not. That's not. That's not right. It's not ethical. So we need a standard of care
Hmm.
around the whole hub of everything.
Hmm.
Mobile dentistry, that was a rare situation. Most mobile dental clinicians have everything that they need, their units, but we need to have a bar that people need to meet. And this is what ACHC brings to the table. And it's not easy. We've been preparing for this for many months, but it's worth it. It's worth it. And I'm honored to be able to be a part of this. I'm honored to be able to have our team level up. We've had meetings after meetings, and our book is this thick, but it's worth it. It's worth it to be able to raise the bar and make
Well,
everyone jump to that bar. Does that make sense?
it does, and I agree with you, and especially it ties back to what you said earlier about
Mhm.
the idea that you're both meeting the needs of, rural Americans or people who may have mobility issues, children with access
Absolutely.
problems. But you also described something that was pretty much like a concierge service,
Ooh, I
which
like
is
that
which
word,
is a
concierge.
very high level. And if we have a standard, I mean, there's no reason why someone with a child in a Head Start program isn't getting the same level of service that someone who could afford to have a service come to them. I mean, it should all be on the same level. And
Absolutely.
so that's what, from our perspective, that's what accreditation does. It not only improves the quality of care delivered to patients, but it also helps you manage your business more efficiently and more effectively, to raise the bar on that. So, it's all kind of one big picture. So,
And to what you're saying, there's always hospitals get accredited.
mhm,
Medical clinics get accredited.
mhm.
Dentistry is a medical profession. Why
Yes,
shouldn't there be some accreditation there? Does
yes,
that make sense?
absolutely,
That just
absolutely.
makes sense. So, I like going to hospitals that are accredited. I like knowing that my doctors have certain accreditation behind them. So
Mhm.
why shouldn't dentistry have the same standard?
Absolutely. All right, so I'm gonna switch angles here a little bit. As I was doing some research and looking at your great TED talk on YouTube and reading articles, it struck me that it really looks like mobile dentistry. A lot of the drivers behind it are women,
Yes.
and I wondered about that. Do you have any thoughts about why that is?
Yes, I read a study recently that within the next 5 to 10 years, that many of the dentists will be females, and it'll probably be more hygienists than it will be dentists. And I think that is already the case now.
Mhm.
So I noticed even at our conference, there are a lot of male dentists and male hygienists that attend, but for the majority, it is women. And this is just the year of the woman right now. So I'm excited to be a part of this. But most of the women that are stepping out, especially hygienists that are being independent and stepping out, started their own practices. They're women, and they have that push behind them. I think the face of dentistry is shifting as we've passed what we've seen in the past.
That is very exciting. I know it must be exciting for you and Melissa because you're at the forefront of this movement.
I'm so excited. I love it.
Well, Sonya, if there's one thing that you would like someone listening to the podcast to take away from our conversation, what's the most important thing that you want someone who maybe doesn't know very much about what it is that you do, what would you like them to take away?
That if there's something that you have a desire to do, if there's a passion in you and you want to fulfill it, take the leap. That is my thing. I always have a word every year. My word this year is take the leap. If you wanted to start mobile dentistry, do it part-time. I started out part-time. I was full-time with the company, and I started doing mobile dentistry on Fridays. I got one nursing home, and I went in every Friday for one Friday a month, and I grew that until I started getting word of mouth, and the nursing homes grew and grew until we just had, the number that we have. But if you have something that's burning in you, just take the leap. You don't have to take a full leap. You can just take a little leap, but take the leap and learn what you need to learn about it and just do it. This is the year. If you want to do something, just do it. Life has shown us that nothing is certain. I never thought that I'd ever be locked out of nursing homes. I thought that was something that would actually never happen, but we were actually locked out of nursing homes. We couldn't go in.
Right.
So if there's ever something that you wanted to do, just do it. Take the leap. If it's not a full leap, take some type of leap and start pursuing your dreams.
Oh, that's beautiful. But you know what? And this is a great place to end, but I've got another question. So
I love it.
Because you mentioned that you were locked out. I mean, all the nursing homes were in lockdown and you couldn't go in. So was there a workaround? Teledentistry.
We were able to send the teledentistry cameras into the long-term care facilities. And the nurses that were on the, especially the ones that are on the COVID ward, they were able to take pictures and send it to the dentist. And we were able to see if that was something that we had to go into to at least to see if there was something that we could do. So we were able to do teledentistry while we were closed down. And we did have to go in and do some extractions, and we had an isolated space that we had to go into. So we were locked out as far as going and doing preventative care, but if it was an emergency where someone could not eat, we had to go in. And we were able to do the teledentistry to go in to have the nurses see before we make a trip there and be at risk of COVID. Wow. So yeah, the teledentistry is amazing. So it goes together with mobile dentistry, like that peanut butter and jelly, man.
Just like you said. Well, that's great. Thank you so much for spending some time with me today. This has been really interesting. I'm excited to see what you do next.
Beyond the Standard is a production of Accreditation Commission for Healthcare, providers of accreditation services for a wide range of community-based healthcare providers, including home health, pharmacy, DemiPose, home infusion therapy, behavioral health, palliative care, hospice, and renal dialysis, as well as hospitals, laboratories, and ambulatory surgery centers. Each episode of Beyond the Standard takes a look at an impactful idea for healthcare provider organizations. We're especially interested in those that help organizations improve as they seek to meet the needs of their communities and the patients that depend on them. ACHC is by providers for providers. Before you go, share your feedback by leaving us a review on Apple Podcasts, and check out our schedule so you don't miss upcoming episodes. For more information about ACHC accreditation, visit achc.org. While you're there, you can subscribe to this podcast and sign up for our newsletters.